management protocol in surgery, in the recovery room, and pre-discharge. The specific protocols for anesthesia and recovery management are published in our paper on 24-hour recovery and are included in PDF format on this DVD. Prior to discharge from the surgical facility, a patient educator reviews our recipe for recovery with the patient and the patient's caregiver. These postoperative instructions, our recipe for recovery, are also included on this DVD. This review occurs in the step-down room with the patient so that the patient and caregiver hear the same instructions. A copy of these written instructions is printed on brightly colored paper and provided to the caregiver to take home. In later phone calls, office personnel constantly refer to the information on the printed recipe for recovery to assure consistency of information delivery. The postoperative care regimen that I'm about to describe has been used in over 3,000 patients over the past decade. During the past 6 years, 96% of our primary augmentation patients, most with subpectoral and dual plane pockets, returned to full normal activities within 24 hours. More than 85% are able to go out to dinner the evening of their breast augmentation. The techniques and processes that enable this dramatic improvement in patient recovery have also dramatically lowered complication and reoperation rates, as documented in our most recent published studies and referenced and included on this DVD. The patient returns home or to a hotel and is instructed to sleep for no more than 2 hours, and then get up, eat a light snack, take an 800 milligram ibuprofen, get into a hot shower, and wash her hair. This sequence rapidly mobilizes her and encourages early arm movement above her head. When out of the shower, the patient blow dries her hair, further encouraging arm movement, and then performs a set of 5 straight arm lifts to touch the back of her hands over her head every hour thereafter until bedtime. We encourage every patient to get out of the house to go shopping, to a movie, or to dinner the evening of surgery, and more than 85% are out the first evening or caring for their children at home. If the patient has small children and no help, we encourage her to be up and active, performing all normal activities immediately, remaining mobile, and performing her arm lifts every hour until bedtime. At bedtime, patients are instructed to lie prone directly on their breasts for 15 minutes, then roll to the side to get up. Patients are naturally very skeptical of pain when asked to do this, but most describe actually feeling comfortable but strange when they first feel pressure on their breasts. This simple maneuver immediately removes fear of damaging implants, fear of motion, and the patients internalize and acclimate to the presence of their implant within 3 to 4 weeks instead of 3 to 4 months. On the first postoperative morning, the patient repeats exactly the same regimen she followed the afternoon of surgery. All patients are instructed to resume absolutely all non-aerobic activities, including driving their car, lifting normal weight objects, the first postoperative day. Management during the first 6 hours postoperatively is critical to predictably delivering rapid 24-hour recovery. The patient must receive a phone call from the office between 2 and 3 hours after she leaves the surgical facility to assure that she's up and showering. A second call prior to bedtime assures that she's continuing her arm-raising exercises and has been prone on her breasts. Patient education and the consistency of the message from all personnel is essential for optimal rapid recovery. More drugs and less activity are never acceptable, and trained personnel must deliver whatever degree of tough love is required to manage patients during the first critical 6 to 8 hours postoperatively. Patients who are not on the program at the end of 8 hours never recover optimally, so optimal management in the early postoperative period is critical.
So it's been almost 24 hours since you left here yesterday. How was it when you got home, and tell me what you did when you got up from your nap?
When I got home, I did my arm raises.
Before your nap?
Before my nap.
Good girl.
And then I laid down and slept for about 2 hours, and when I got up, I took an ibuprofen and waited about 30 minutes and took a shower. And then I was able to dry my hair and put on makeup and take my daughter out to eat.
Excellent. Very good. So you do your arm raises from first time when you got home all through the evening.
Yes, every hour, and then I also laid on my stomach for 15 minutes.
Can you show me your arms?
Yes.
Good girl. Good girl. Do another one for me. Excellent. And how do you feel today?
I feel good.
And you drove yourself here?
Yes, I did.
Excellent.
Over the past decade, processes and techniques have been developed that totally redefine the patient experience in breast augmentation. These processes enable most patients to be out to dinner the evening of surgery and enable over 95% of patients to return to full normal activities within 24 hours following their augmentation. More importantly, these processes and techniques enable dramatic reduction in reoperation rates and minimize risks of tissue compromises and uncorrectable deformities. The Style 410 anatomic form-stable cohesive gel implant and the family of implant products it has produced have been instrumental in stimulating refinements and new processes that have directly impacted patient outcomes and have redefined the patient experience in breast augmentation. No other implant products in history have been associated with so many advances for patients as the 410 family of products. Regardless of the quality of any breast implant product, surgeon and patient decisions ultimately determine patient outcomes far more than any breast implant characteristic. No implant design can compensate for compromises in tissue-based implant evaluation, implant selection, prioritizing soft tissue coverage long-term, and optimal surgical techniques that create rapid recovery. At no other time in the history of breast augmentation have there been as many opportunities to advance the patient experience. Proved processes that are peer-reviewed and published, combined with state-of-the-art implants from the 410 family of products, offer patients improved outcomes and a redefined experience in breast augmentation. The Allergan Style 410 family of products are the only products in history that stimulated the development of processes that have redefined every aspect of the patient experience in breast augmentation.